In this animation we will show what causes menstruation, what is responsible for menstrual cramps, and how Menstrual acts to ease the discomfort associated with such cramps. The uterus is an organ that has thick muscular walls. Every month the ovary releases an egg into the fallopian tube where it travels into the uterus. The egg is about the size of the head of a pin. The inner uterine wall becomes thickened with nutrients and develops an enriched blood supply. If the egg is not fertilized, the uterus produces a hormone called prostaglandin. This hormone causes the wall of the uterus to contract and expand, thus causing the egg and the extra nutrients to be expelled. This is menstruation and can be associated with painful and sometimes debilitating cramps. Running through these muscular walls are tiny blood vessels, which supply oxygen and vital nutrients to the muscle tissue. When these muscles contract during menstruation, these blood vessels become constricted. This will reduce the amount of oxygen getting into the muscle tissue. The muscles are literally starved of oxygen, and this lack of oxygen is what actually causes pain. Pain impulses are carried by nerve cells that are attached to those muscle fibers. The place at which the nerve cell attaches to the muscle is called a neuromuscular junction. These electrical signals then travel across the network of nerve fibers and eventually end in the brain via the spinal cord. The brain interprets these signals as a pain in the muscles of the uterine wall. These are known as menstrual cramps. Menstrual is applied to the surface of the skin right at the site of the pain. The menstrual causes the nerve cells to disconnect at the place where one nerve cell connects with the next. This is called a synapse. Menstrual disrupts the passage of the pain impulses and hence reduces the amount of pain that's being carried to the brain. Even though the muscles continue contracting and relaxing, the number of impulses being transmitted to the brain is lessened, and this will result in a feeling of reduced pain.